Next IV fluid is Isolyte. Isolyte, also known as multi-electrolyte injection. It comes into 100 ml, 500 ml and 1000 ml concentration. If we talk about the composition of Isolyte, it consists of sodium chloride, potassium chloride, sodium acetate and sodium gluconate. Uses of Isolyte. Isolyte should be used in adults and pediatric patients. In CP or cerebral palsy patients, it used in measles and diarrhea. Isolyte should not be used in pneumonia, in kidney failure patient, in pulmonary edema, in severe metabolic acidosis condition, or in case of hypertension. Next IV fluid is Manitol. Manitol comes into 5%, 10%, 20% and 25% concentration. It also present in 100 ml and 500 ml volume. If we talk about the composition, it consists of mannitol and water for injection, which is quantity sufficient. What are the uses of mannitol? Mannitol used to increase urination. Mannitol is used in cerebral edema, in glaucoma, or in acute renal failure, and it is used to test for asthma. Mannitol should not be used in respiratory tract infection, in fever, in hypersensitivity, or in pulmonary edema. It should not be used in hypertension. Next IV fluid is Phlabolite M. Phlabolite M come into 500 ml or 1000 ml concentration. If we talk about the composition, it composed of calcium chloride, glucose, potassium chloride, sodium acetate. Uses of Phlabolite M, it should be used in burn, it should be used in acute blood loss, in hypotension, in acidosis, or in electric shock. Flavolite M should not be used in hyperglycemia, fever, hypertension, pulmonary edema. Next IV fluid is Hemasil. Hemasil come into 500 ml or 1000 ml concentration. Composition of Hemasil, it consists of polygylene, sodium chloride, potassium chloride. Uses of Hemasil. It should used after delivery, in heavy blood loss, in low plasma, or in low electrolytes condition. It should be used after surgery. Condition in which Hemasil should not be used is hyperglycemia, kidney failure, hypertension, pulmonary edema, and bradycardia. Next IV fluid is Provas. Provas come into 100 ml. Composition of Provas is it consists of paracetamol, which is active ingredient of Provas, and it contains liquid vehicle, which may be water for injection or distilled water. Uses of Provas, it should be used in fever, in headache, or in backache and other pain. Provas should not be used in hepatitis condition, in kidney failure patient, in hypertension condition, in hypersensitivity reactions. Next IV fluid is Flagel. Flagel come into 100 ml or 500 ml volume. Composition include metronidazole. Flagel contain metronidazole drug. It also contains liquid vehicle in which this drug is dissolved. Uses of Flagel. It should be used in diarrhea, after surgery, after childbirth, dysentery. Flagel should not be used in pregnancy, hypersensitivity reactions. Next IV fluid is Panamine G. Panamine G come into 500 ml. Composition. It is composed of D-sorbitol, mineral and electrolytes, amino acids, water for injection, which is quantity sufficient. Uses of Panamine G. Panamine G should be used in hypoproteinemia after surgery, malnutrition, provision of amino acids, should not be used in severe kidney disorders, in hypersensitivity reactions, in pulmonary edema, in hypertension. This was all about the lecture.